as you can see on our poster, we started back in 2021 with making online learning sessions for nurses in Sub-Saharan Africa. We started with Kenya and Ghana, and then we've expanded since then. These monthly lectures are really tailored towards nurses and residents in Sub-Saharan Africa, providing them education on disease-specific, radiation, medical oncology, chemotherapy, immunotherapy, all of those treatments and toxicities and how to manage that. In addition to
So
that,
these are schools from the different...
so these are hospitals that we're working with, but there is some of the nurses at those hospitals will also do some instruction at some of the universities in Sub-Saharan Africa, and they will share the link with them, and they're invited.
Okay.
Anybody can actually attend these. It's free.
Okay.
So we're open to anybody attending.
Okay.
In addition, we also offer certificates of participation to these nurses so that they can put this on their CV and show to their nurse manager that they're doing some education on their own. And then we've also done some bi-directional learning. We've done a few workshops where we've gone over to Sub-Saharan Africa, and we've done these workshops over 3 days. We'll do lectures multiple times throughout the day, and then also be in the clinic with them in real time to help answer questions and work through patient scenarios. And then we've also brought 3 nurses over to our clinic for a 2-week observership where they rotate around with medical oncology, radiation oncology, palliative. They get to see different procedures like brachytherapy, and then they get to learn from our clinic, just being fully immersed for those 2 weeks.
Okay. Can you talk to me about yourself?
Yeah. Yep. So I'm a nurse practitioner. I work at Mayo Clinic in Rochester, Minnesota, and I work in the Department of Radiation Oncology, specializing mostly in head and neck cancers, hematologic malignancies, and benign conditions. And so in 2020, I was approached by one of my physician colleagues who he had been working through the clinic and had created Global Bridges Oncology that really focused on doing some education for physicians and residents over in Sub-Saharan Africa. And so they have been doing global outreach, doing mostly Zoom lectures, and then had some preceptorships going back and forth. But then they also approached us asking what we could do for the nurses. And so that's when myself, as well as Laura and Casey, my colleagues who we met out there, we created the Global Bridges Oncology Nursing Seminar, where we really tailor education for nurses in Sub-Saharan Africa.
So what made you choose to participate in the program?
Yeah, so I've always had, so prior to my work at Mayo Clinic, I actually did public health nursing for a couple of years too. And then working with the physician colleague, Dr. Merrill, who was already doing that work with Sub-Saharan Africa before he asked me. I really got to learn what he was doing, really found it interesting, and wanted to find a way that I could help. And so he invited me to join with and lead off the nursing program.
And so how did your journey into nursing started?
For me personally?
Yeah.
So I started off at nursing school, graduated in 2009 from nursing school, 4-year degree, and then I worked in public health for 2 years. And then I transitioned to a hospital where I worked in a post-surgical unit for a few years, and then I went back to school for a nurse practitioner. So I'm actually a family nurse practitioner. And then when I was in school, my little sister was actually diagnosed with lymphoma. And so that really piqued my interest in oncology. And so I actually asked to have oncology rotations. I fell in love with oncology as a whole. And so when I graduated nurse practitioner school, I specifically chose a job that worked with oncology. So that landed me in radiation oncology, which I started in 2017. And that's where I've been since then, same department, working with the same individuals. So it's something I've always been interested in healthcare. I really enjoy people, and so that really got me into the nursing track. And then some of my own personal experiences has really guided me towards working in oncology.
So since you have started the program, what were the challenges that you have met?
Yep. Some of the challenges that we've met, especially with our lecture series, with the time zone difference. And so we give our lectures, so I'm in in the Midwest, so Central Time Zone, so we would like to do the lectures at 8 a.m., but that usually means that it's afternoon or early evening for some of our folks in Africa. So that is probably one of our biggest challenges, is trying to find a sweet spot that works for our lectures, because most of our people who are giving lectures have clinic the rest of the day, and so they're not able to carve out time. Our positions don't give us clinic time, so we have to kind of do this on our own time, and so that's the hardest part, is really trying to find a time that works for everybody. And then some of it is just making sure that the bidirectional has been really helpful for us to go out there and understand how these clinics function and what kind of resources they have. And so a lot of it is when we find lectures, we really have to make sure that they tailor their lecture series so it's applicable and so it's helpful for those individuals, to make sure that they're reviewing their drugs ahead of time and making sure that those are drugs that they also have available there, so that we're giving information that they can use with the resources that they have.
And what have you liked about it? What do you like about the program?
I love helping individuals, so it's really great, and I have found the nurses that we work with, many of them are really good friends of ours now. Everybody is so appreciative. We go there, they treat us like family, and they are so eager to learn. They want to get every little drop of information that we can provide them, so it's a very welcoming. I really do feel like family when we're out there, and so I love working with them and helping them, and just improving global health as a whole has been really impactful, and really drives me to keep doing this work and try to keep making things better too.
Okay. And what keeps you motivated?
What keeps me motivated, honestly, having some of these relationships with those nurses there, and then reaching out and us just having this discussion back and forth and talking about how we could really help the program grow, really helps motivate me to come up with things like making certificates of participation or coming up with platforms that they can access these in real time. So they keep me motivated. They always challenge us, saying like, how about we do this? How about we do that? And that actually is motivation for me to keep trying to improve things. And then they have great ideas too. And so when we go out there, they already know what kind of lectures they want us to give. And so it's very motivating, and they are so eager to learn, and they are so passionate about taking care of their patients, and so that really helps drive me to help out too.
Do you have other areas of interest?
Like
that, or do you have any other project or other things that you're working on?
Sure. So I'm a nurse practitioner in the clinic, so I see patients most of the time when I'm at work, but I'm also really into like head and neck research as well, especially survivorship, so helping take care of the patient after treatment is completed, really making sure that they have great care going forward into survivorship, really helping reduce the toxicities that they have and helping them improve their quality of life with the toxicities that they have from treatment. And I'm also big into education, and so within radiation oncology, I'm actually creating an APP radiation oncology fellowship at our institution right now, so that takes up a good chunk of time too. But that's really a way for people who they might have an interest in oncology, but they're not sure if they want to accept a position in oncology, and so they can go through this year-long fellowship where they work with us. They get to go through different disease sites, and at the end of the year, then they can decide if they would like to apply to be at our institution or another institution in radiation oncology, or maybe they say, hey, that wasn't for me, but I'm glad I tried it. So it's a really cool way for somebody to try it out without committing to an institution for a long period of time too. But I'm really big into education, and then I really like head and neck toxicity survivorship management.
Is there, if there is one thing that you have learned in your journey in nursing and this program that you guys are running that guides your decisions and overall well-being, what would that be? Or what is it?
Yeah, so something that guides me is just recognizing the limited resources that somebody might have, and trying to figure out how I can use the knowledge that I have and meet them that they can use the resources that they have to really improve patient care. And so just having that connection and collaboration with somebody, meeting them where they're at, and then working together to really improve patient outcomes really is important to me and helps guide me and motivate me too.